10 a.m. or on YouTube, channel DZRJ 8:10 a.m. Radio Bandido.
The views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole, Jacinto. Join us on Healthline with 𝗥𝗲𝗵𝗹 as we discuss the latest health and medical topics with doctors from 𝗥𝗲𝗵. For a healthier and uplifting lifestyle, tune into Healthline with 𝗥𝗲𝗵𝗹 on DZRJ 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗥𝗲𝗵𝗹, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗥𝗲𝗵𝗹 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Good evening, welcome to Healthline with 𝗥𝗲𝗵𝗹. I'm your host, Nicole Jacinto. Dr. Caroline C. Aquino, who is an allergist or allergologist, is back with us today to talk about the topic of allergy. And but it's timely that she's here for me. But I hope that all of you are well. We all hope that all of you are well and that there's a lot that you can pick up from this show. So Dr. Aquino, can we start off with what exactly is an allergy?
All right. So when you say you have allergies, it's that your body developed an IgE antibody to it. So it's very specific. Let's say you have an allergy to dog danders or to the fur of your dogs. It means you develop an antibody to the dog dander. So basically you develop an antibody that will make you react every time you encounter that specific allergen.
Okay, so we call these things that we're allergic to allergens, and
Right.
you know, some people will say, how come, you know, some people have it and some people don't?
Right.
So it's a reaction of the individual.
Yes, it's environmental. Well, environment now plays a very big role because it changes how your allergens act, but at the same time, it's very genetic as well. But there are a lot of patients now who don't have family history who also develop an allergic reaction. So it's still exposure. Because if you think about it, even before, diba, parang, obviously during the time of our grandparents, there were really a lot of vacant lots, a lot of these different weeds and grasses that grow. But if you think about it now, how come we get these allergens from the pollens? It's because also of the climate change that changes the structures of these allergens that make them stay longer in the air, that makes us react more. And at the same time, if you think about it, what about the pets? But back then, the pets don't really sleep with us. They would usually stay in one area. So more exposure would lead us to more development of these allergy antibodies.
Okay, so let me just ask about the environment first and climate change. So basically, when we're exposed to things in our environment, even if it's not, you know, poisonous exactly to the body, but your body can develop an allergy to it from prolonged exposure, or because genetically you're prone to develop some allergies. And you were saying like the time of our grandparents, even the time of our parents, you know, the climate there, you can really feel climate change, especially in a country like ours. Like we're situated in a place where we're the first one to feel it. Okay, so you were saying that some of the structure of the allergens themselves, like let's take the example of pollen, grass pollen or tree pollen or whatever other kind of pollen, their structure has also changed because of climate change.
Climate change, remember, like the air density now is just so different. And if you think about it, industrialization really played a very big role. Now there are just so many people who have allergies to dust mites, especially those who are living here in the urban areas, diba? Kasi nga, it's very industrialized. So there are just a lot of people coming in with really bad allergies to dust mites. So if you think about this, but doc, we clean all the time, ganyan. Pero talagang they really develop antibodies to it, and they really have a very severe reaction to it. It's because environment really plays a very big role. So even if, let's say, genetically speaking, you weren't, your family doesn't have any allergies to it, you're still prone to getting it because of the changes now that we have in our time.
Yes, doctor. And Metro Manila being a very highly urbanized center, and also I'm sure there's like the pollution, and I mean the pollution from cars, smoke because of the long traffic. We have notorious traffic jams here. Like every day is a traffic jam. And there's all of the smoke, and maybe some factories or whatever it is. We do get more exposure to it, and you will hear people say we clean a lot, and then yes, you do clean a lot, but it still somehow gets in, doesn't it?
Yes.
And dust also. Okay, and then if you keep your windows closed, you also don't get the air out. And there's this whole cycle of cleaning and air purifying that goes along with it. Okay, so doctor, what are the most common types of allergies in the Philippines, or based on like the people you treat who've walked into your office?
Well, I think in our countries, just like the others, we still have a lot of patients with allergic rhinitis and allergic asthma. And now we are also seeing a lot of patients with atopic dermatitis or atopic eczema. And then urticaria still is present, although urticaria is not always allergy. But I'd say that the top would still be allergic rhinitis, allergic asthma, and atopic dermatitis. Although food allergy, I have to say, is now gaining traction. We see now more pediatric patients with food allergies, that unlike before, like when I was in maybe like a decade ago, we rarely see pediatric patients with food allergies. But recently now there are a lot of patients, or there are some patients who are now presenting with food allergies. Yeah.
Okay. So doctor, I guess to make it easier for me, I'll ask you some things to make it easier for me, because it's easy.
Okay.
I think it's easy for you. I'll ask about the inhalants, things that people inhale, and like the on the skin, when you get rashes or urticaria, as you said. And then I'll ask you about the food allergies, because that's like for me it would be a long discussion that I'd like to dive into. I won't make it that long. You're gonna have to.
Okay. Yeah. There's just a lot to talk about when it comes to allergies.
Yes. Okay. So you mentioned urticaria. It's still present, but sometimes it's not always allergy. Is that skin irritation due to something that?
Actually, with urticaria, it's really very complex. Okay, so there are some that's brought about by the allergies, but there are also some urticaria that is brought about by what we call physical urticaria, physical contact, like when you scratch, or like some people when they write, or when you have a pressure on your body, it can also produce urticaria. So not all urticaria is an allergy. And I guess for everyone who's listening right now, one of the things that we want you to be aware is that when you see on yourself or other people that they develop hives or wheals or pantal, don't always think of allergy or what food that patient ate the last time, because it can be something else, not necessarily the food that caused the urticaria, right? So it can be other things. Actually, to some, if they change lotions or soap, detergent, or to some, especially in adults, very common, it's idiopathic, as what we call it, or walang cause. Pwede. There are some, especially in children also, most common cause is an infection, 80% of the time. So you look into that. So kung let's say, parang the patient, a child comes in, nag-urticaria, so you have to ask the parents, kasi usually when they look, chicken lang po yung last na kinain. But then, don't always look into that. You ask, wala po ba siyang sakit or cough, cold, or did they receive any new vitamins recently? So you look into that, no? So don't just think of food as a trigger when it comes to urticaria, because there are a lot of things that can be the cause of your urticaria.
Okay, thank you, doctor. So also, of course, that's why it's important to ask someone like you, and this is your specialty.
Yes.
Because I guess you have to take in the picture as a whole. And I'm sure there are a lot of people who get panicked out when it comes to the food because they've experienced, there's like different levels of allergy, and we can talk about that later.
Yeah.
But it's like, of course, you panic at a certain point, like if there's a patient experiencing allergy like from everywhere, but you do have to take in to consideration all these things. And then some people say, maarte yan kasi ganyan maselan. But actually, yes, it could be the laundry soap.
Yes.
Baka nagpalit
Yes.
ng laundry soap. Or
Right. Yes.
I mean, even on your clothes, diba? Just the residue. You wash your clothes or you
And
change.
then irritant. Yes.
And then or even like your hand soap or your bath soap, and maybe a cologne or a perfume.
Yes.
Masyadong matapang, you know.
Correct.
And then it's like, "Bleh." Okay. So anyway,
And actually, sometimes there are some people who feel na parang what they have is an allergic rhinitis, but there are some people who just have vasomotor rhinitis, like strong scents. Mabango, or any strong scent can also trigger rhinitis, but that's not allergic. Then it's vasomotor. So I remember one time in our convention, one of the foreign speakers said that, before you consider also an allergic rhinitis, you ask the patient, do they do, diba now there are a lot of people who do scents.
Scents, yes.
So sometimes that might be one of the cause of the rhinitis, not necessarily because of the dust or if they have pets, but it can be because of the scent. So it's vasomotor rhinitis. So that's one of the things that we also ask and look into.
So I have that and allergies. I mean, my sense of smell is so strong that I can smell things from a mile away, and really just like very flowery perfume can make me throw up.
More to have rhinitis.
Yes, and it can make me throw up to the point where I'm gagging.
Okay.
And just to share a bit, like there were times when I'd be like, may patay na daga dito somewhere and no.
Yes.
Wala. Then meron, I can smell it. 3 days later, everyone's like, may patay na daga dito. I'm like, I told you 3 days ago. So
then you're very gifted.
is that my superpower?
Yes.
Okay. All right. Okay. So okay, so I know a few people who are like that also. Very strong sense of smell.
Yes.
But at the same time, I mean, so let's get to the point where it is an allergy. It happens to be an allergy. So doctor, when it comes to how about people who are unaware that they may have an allergy? What are the typical signs or symptoms, because they've never had it before, let's say, or someone clean history of allergy. By the way, can you just develop an allergy anytime in your lifetime?
Yes, you can. Yes, you can. Even in adulthood or remember in allergy, once you have it, it's really hard to say that you outgrow it. There are some who are controlled. So usually, if it's already the diagnosis of the patient, parang it's really part. Let's say diagnosis siya with asthma, but that was childhood and the last attack is at 7 years old. But you still put that as part of the medical history and part of the diagnosis of the patient that this patient has bronchial asthma. Controlled nga lang. Okay? So there are some patients actually who are very lucky enough and good for them that they only had it during childhood and never again until they get old, no? But yun nga, about allergies. So what are the symptoms, you're asking? Actually, there are different organ systems involved. It depends on what you have. So let's say what you have is more on the respiratory part. Let's say, if it's allergic conjunctivitis, it would present more, so sa eyes, allergic conjunctivitis, by both eyes are itchy and watery na tears. Okay. Yan. So it's both eyes dapat. So it's allergic conjunctivitis. So usually patients with allergic conjunctivitis, ang mga trigger niya are also the air allergy or the pollens kasi maliliit sila eh. So mas nagpapasok sila sa eyes. Okay? Now, if it's allergic rhinitis, it's more on, it's sneezing. Sunod-sunod na sneezing, watery. Kailangan yung sipon is clear, not yellowish, not greenish. It's clear or watery rhinorrhea and itchy nose.
Okay.
Usually you see them doing like that or like that, So, laging may itching kapag ka-allergy. So, that's your allergic rhinitis. But there are some who, what we call yung mga chronic or matagal nang may allergic rhinitis, some of them can present with baradong ilong. It's always nasal congestion. Pwede din. And then with allergic rhinitis, you would note that usually, meron siyang certain time of the day. It's that whole day. And these patients feel fine. Kaya some of them, we see them, it's already, matagal na po. Kasi nga, they're used to it. It's a chronic condition. Sometimes they just come to us when their medications doesn't work anymore. Kasi usually they can self-medicate. So that's allergy. They work well, they feel fine, they don't feel sick. And then you have the allergic asthma. So syempre, the allergic asthma is, it presents more with coughing, no? Recurrent coughing, usually early morning of the day or when they are tired from an exertion, no? Kuwari nag-exercise or tumakbo, yan. So asthma is more on coughing. And then, so that's more for the respiratory. And then others naman also present on the skin, no? Those with atopic dermatitis or atopic eczema, they would have recurrent itching, makating-makate, recurrent rashes, especially on areas, but we call it the predilection areas, meaning merong certain site that you look into na pag atopic dermatitis, doon at doon talaga madalas nagkaka-rashes. So for the older age group, usually it's the flexural, no? It's here, no? Or at the back of the knees, no? So usually yan. And then you'll also notice with patients with atopic dermatitis, pagka summer sa atin, that's when it really flares, and when they're sweating, it really flares a lot. Okay, so that's usually the and then the severe type of the allergic reaction naman is what we call the anaphylaxis. So usually the anaphylaxis should have two organ involvement, meaning pwedeng difficulty breathing, parang may asthma attack ka, and rashes. So that's two organ, the skin and the lungs. Or you can have rashes and hindi ka difficulty breathing but you're having diarrhea and vomiting. So that can also be anaphylaxis after an exposure to a known allergen. Or bigla lang, actually ito, this is pretty hard to get, no? Yung bigla lang nagbaba ang BP or hypotension as we call it after an exposure to their known allergen. So there are really different criteria, let's say, for anaphylaxis. So but you have to ask, and very important, of course, is the history of the patient. Kasi usually in patients with allergy, it happened already before. Can it happen a first time, severe? Pwede rin. Pero let's see kung ano talaga yung trigger and if it's really an anaphylaxis. Parang ganon.
I have something to say about that, but we just have to take a short break and we'll be back after the break, of course. And we'll talk a little bit more about anaphylaxis and including food allergies and all that. So folks, stay tuned. We'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
This is Dr. 𝗛𝗲𝗁 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗥𝗲𝗍𝗵𝗍. Available for outpatient care services, our 𝗥𝗲𝗍𝗵𝗍 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗥𝗲𝗍𝗵𝗍 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗥𝗲𝗍𝗵𝗍 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗥𝗲𝗍𝗵𝗍.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. We're here with Dr. Line. Iniksiyan ko na yung pangalan. Dr. Caroline C.
Yes.
An allergologist, allergy specialist from Makati Med. We're having a very interesting discussion. We were just talking about anaphylaxis and how you said it's usually two organ systems. So it could be that you're vomiting and you have diarrhea, or you're just vomiting and then you have rashes, or you're having difficulty breathing, or maybe all of the above. And you did say, doctor, that if it's a known allergen already that someone ingested, and I think that people
ingested or exposed to.
Okay, yes, that's true. That's true. A lot of people take it for granted, ingested or exposed to, then you can, you have clues that that's it. And it could also be something also really scary is the first time I mean,
Right.
it's possible that it'll just hit you out of the blue.
Right.
It's the first time that you've manifested an allergy towards something, and it happens to manifest as
It seems to be that bad. Yeah, when it happens,
Oh.
right?
So when you've seen people, let's say in the ER or any, I'm sure you've done your rotations, no? Can you usually tell right away, since it's especially this is an allergy and it's anaphylaxis, or doctors there are also equipped to like, okay, what do you usually inject? What do we do to get this person breathing or stop all of this?
Right. Okay. So let's say, for example, in the ER, a patient comes in. Usually kasi, most common naman, generalized rash, the hives or urticaria talaga. And then with difficulty breathing, and when you do your auscultation or will listen, may wheezing talaga. Then, even before, pwede mo namang i-ask while giving, but very important is to give your epinephrine first.
Yes.
Kasi that's really the drug of choice for anaphylaxis. And then once the patient is better, then that's when you can get a thorough history of what really
Yes.
happened beforehand.
And
Okay?
they're like, and then,
Yeah,
are you sure?
oo.
Bang, you need to deal with
Correct.
it.
Yeah, so that's it. So that's the but remember that not all yung whole body or generalized urticaria as we call it would always be anaphylaxis kasi sometimes they can have difficulty breathing, but when you listen, it's clear breath sound. So baka naman meron na rin konting swelling on the airway. So you just give your antihistamines and corticosteroids to help. So basically, you just really have to check, do a thorough PE pa rin. Check talaga the patient. If it's really an anaphylaxis or it's just as simple as rashes lang or I remember one time may tinawag na patient kasi parang the ER doctor was very scared, but this is in Makati Med, okay? So the ER doctor was very scared kasi the eyes was really swollen na, no? So natakot siya na baka raw mag-anaphylaxis. So nagbigay siya ng epinephrine. Ang nagulat ako kasi sunod-sunod yung epi niya, 3, pero all the other findings are fine. It's just swelling of the face talaga and puffy na talaga yung eyes. So angioedema and swelling of the face. But clear breath sounds and then the vital signs, the BP was normal. So on history talaga of the patient, nagpa-hair dye lang naman yung pasyente.
So then
Dati na siya nagpapa-hair dye. So obviously, it was an adverse reaction to the hair dye. Kaya nasa face yung maga. So like that one. So that one is not anaphylaxis. It's just that talagang because the hair dye is still at the hair, talagang magmamanifest yung allergies niya sa face. Okay? So that's what I'm saying, yun nga, that's why you have to check din talaga kasi on vital signs naman, tsaka on PE, nandito lang naman talaga lahat, no? So that's what I'm saying. So you really check the patient aside from getting, first you have to get the proper history and do your thorough physical exam. So you know if what you're dealing with, is it an anaphylaxis talaga or it's just a plain urticaria or angioedema on the patient. Yeah.
Alright. So doctors, did you hear that? Yung doctor na rin na ito. Okay.
No, that's okay. We're here to educate.
Yeah.
That's why we have this.
That's right.
That's okay. Yeah, yeah.
And then also doctor, let's say, okay, there's this question that comes up. You did mention earlier, so let's go to that you're seeing a lot more food allergies in pediatric patients, so kids.
Right.
You're seeing this trend, do you have, like, are there studies or do you just like, what's your opinion? Why is it happening more often to the population now here in the Philippines? That where children are starting to get more food allergies.
Okay, actually, that's also one of the, we don't have the numbers yet of how many, actually our society, the Philippine Society of Allergy, Asthma, Immunology is now coming up with a registry, what we call it. So we have an idea more or less how many patients or how many Filipinos have this type of allergy. Kasi that's really one of the things that we lack, honestly, in our country. So parang the reason lang we're saying that we're seeing more is, alam mo yun, when you get to see your fellow allergies, ganyan, sa papag-usapan. Now, kasi back then, pag pinag-uusapan yung food allergies, very common in Western countries.
Yes.
Sa atin, wala masyado noon, at least when I was a decade ago nga. But then now, siguro in my practice, I'm seeing more patients who present talaga with food allergies. So, what is the cause? Well, one, honestly, we don't know if it's in the maternal diet. Kasi syempre, iba na yung generation ng mothers ngayon, right? Was it in something during... Well, it's really hard to say what the trigger is. Or one of the things that we're looking into also is yung the food preparation now is just not as simple as before, di ba? Parang ang dami ng processed food, ang dami ng colorings, ang dami ng preservatives. So these are the things that can also, but it might be one of the triggers or one of the cause why there are more food allergies now. So yun yung mga things that we're looking into also, yung changes in the generation now versus yung dati. Yeah.
Thank you, doctor. Also, okay, so we were talking about younger people, children.
Yes.
So some people will say, I've never been allergic to that, so I can't possibly be allergic to that, right?
Right.
Can you get an allergy anytime in your lifetime?
Yes, yes you can. Yes you can. Pero remember, that's what we're saying is you really have to check if it's really an allergy. Kasi nga sometimes there are a lot of patients na, I develop allergy po nung kumain ako ng chicken. Pero actually, pwede naman kasing nag-hives siya at that time because of something else. What we notice, there are a lot of patients still that when they get the rashes, the first thing that they look into is, ano ba yung kinain ko? What did I eat the last time before the rashes came in? Hindi ko makalimutan, one patient had rashes. Tapos lagi, chicken. Kailan po ba kinain? Yung pala 2 days ago pa. Ang dami na niyang kinain in between. So baka naman, hindi na yun yung cause ng allergy na, di ba? So that's what we're looking into. You have to really check and consider all the factors before you say na that is the ano. And can you develop it at a later time? Yes, you can. Although so far sa food allergy, parang rare yung adult that you'll get it. Pero pwede. Just remember, if you're really allergic to it, it should be that every time you encounter or every time you eat it, the same reaction should occur. Not sometimes, yes, sometimes. So, hindi. The only recent change now in the study, in the field of allergy, actually, is that the shrimp, they found out in the recent studies that the shrimp has a similar structure to dust mites, to house dust mites. So now there are studies coming out that if you have allergies to house dust mite, if you eat or consume too much shrimp, you can have an allergic reaction. Kasi same yung structure nila.
Okay.
So that's one of the recent development in allergy that they found out that some patients who had a history of reacting to shrimp, when they do the allergy test, negative to shrimp, pero positive sa dust mite.
Okay, so since it's the same structure, it reacts the same way because your body
cross-reactivity, yes.
remembers like, looks like the dust mite thing, let's attack it. And am I correct in saying that it's actually maybe not harmful to your body per se, it's not poison, but when you ingest or are exposed to something that you're allergic to, that particular allergen, your body remembers it. So so it's like, attack agad. And those symptoms of trying to get it out so very efficiently, that's also what gives you the symptoms like the sneezing, the coughing, the difficulty.
Yeah, because when you encounter it, so you have the allergen that comes into your body, the antibody will now recognize it. And then once they recognize this allergen, it will now release the different, we call it different mediators or different cytokines, like the histamine, it's all released. And that's the reason why all these symptoms happen. So you're correct in saying na ang allergy naman, yes, hindi siya nakakahawa. That's correct. It's not a poison. But the problem kasi with allergy is that if severe, or you'll never know when you'll get a really bad reaction, no? Like yung anaphylaxis nga, as I've mentioned, you'll never know when it will happen. Kasi there are some patients din naman na, actually, doc, I'm allergic to it, but I keep on eating it. So actually, there are some people, pag alam nilang kakain sila ng seafood, alam nila allergic sila, so they'll take antihistamine before they eat kasi it lessens the symptoms. Pero in the literature, what they say is do not encourage it kasi you don't know if by the time you encounter it, if your reaction is not severe. Diba? Pwedeng nag-take ka na antihistamine pero it's not enough to control your symptoms. The symptoms might still be bad. So technically speaking, and actually what we're saying to the patient is that if you're really allergic to it, then you cannot take it anymore, or as much as possible, talagang no exposure for you to lessen your symptoms. And remember, allergy over time, the more you're exposed to it, the more antibodies you develop.
So the worse it gets.
Yeah, it worsens over time.
I really wanted to get into that and get to that point because many people say, And then I outgrew the allergy. Well, I don't know, maybe talk to an allergologist. It's possible because he said,
Right.
I was allergic to that when I was a kid, but now I'm not anymore. Well, then good for you if that's true.
Right.
Then there's also this misconception, especially in the Philippines, na no, just keep eating it and then you'll get
Right.
over it.
Yeah.
And that makes
Yeah.
it worse, doesn't it, doctor?
That's what I was saying. Yun nga, di ba? Parang sometimes kasi ang tendency natin is to think, kuwari nag-rashes. Ito very common talaga nag-rashes. Ano bang huling kinain mo? Chicken. Allergic ako sa chicken. So parang they have that notion. And then after a few months, kakain sila ulit ng chicken, okay na sila. So that's what I'm saying. Baka at the time that they had a reaction, it wasn't the chicken. Kaya nung kinain nila ulit, okay na. And then isip nila, ay, okay na, na-outgrow ko na. When actually, baka naman it wasn't the chicken in the first place. Okay, so yun yung ano rin doon. And remember back then there were education was not as big as this. There was a social media and there were not konti lang the allergies back then. There were just a few. So not everyone really can have an allergy test or can be guided correctly. Kasi what I've noticed also, there's still a lot of doctors na parang they take it at face value whatever the patient would say. Like, kuwari, allergic po ako sa chicken. Kasi nung kumain ako ng chicken, nagpantal ako. And then, yun na. Parang no further investigation, no recommendation for an allergy test. So parang yung patient ngayon believes na yun talaga yung trigger by the time that he had a reaction.
It could be something else that they eat along.
Yes.
I know of a couple. Okay, so let me give you examples that I know about to be true.
Okay.
I know someone who was told by an allergologist when they were like 17 that oh, by the way, you're allergic to chicken, like skin test. And then
Right.
What? But I've been eating that my whole life. Of course not. No, it's not possible ganun. And then nagkaroon ng anaphylaxis when upon eating chicken and also God knows what that night. But then the more the person ate chicken, the worse it got. Like,
Right.
so the person just stopped. And
Right.
exposure also that you're saying is, pwedeng, it's not just eating it, but maybe if you're in a room where there's chicken soup being cooked, I mean,
Yes.
yeah, you can get a
Yes, that's true.
especially for someone like me who has a strong sense of smell. Like, you can smell it. If you can smell it, there's actually a part.
Actually react to it also, even if you smell it or touch it. So I remember I also had a patient, bata pa, child, na parang the concern of the parents is yun nga, every time the patient eats shrimp, he would get a reaction, he would get rashes. And then, ang concern ng parents is how can it be treated kasi they like eating shrimps in the house. So one time parang they ate shrimp, so syempre madumi yung table and the child was playing touching, so na-touch niya yung napagbalatan ng hipon siguro or tumalsik or something. And yung tip lang ng fingers it became really red. So sabi ko sa parents, you know what, I think the safest thing to do talaga is as much as possible, don't eat shrimp na lang in the house. So if you really want, just outside na lang and the child is not with you kasi yung contamination na tinatawag pwede talaga matouch yung child and we'll never know the next time around how bad the reaction can be.
And doctor also, like, when you go out and you order, if you see fussy people, it's not just that they're being fussy, it's that they have allergies. Like, did you cook it with this? Because sometimes they'll cook, maybe you might be allergic to shrimp and chicken, but they'll cook it together, same oil.
Yes. That's true. Actually, kasi in our country nga, yun nga, that's what, not everyone is aware pa of food allergy or how to really handle. Kasi as I've mentioned, back then, hindi naman siya, it's not like in Western countries where they're really very big on it, right? They ask, Now, we're beginning to see some changes. I'm sure you've seen that, right? There are now some, actually, mga more expensive or upscale restaurants, they ask already, any food allergies, di ba? May ganun na sila So, I guess that's what you will, pero hopefully naman, now that there are more cases, and yan nga, social media like this one can be a platform for everyone to get involved, that there are now cases talaga of food allergies. And I just have to go back, because you mentioned earlier na parang, keep on eating it para lang
Maraming ganun.
used to it.
Yeah.
Okay. Food desensitization there is, right? Yes, there is,
right?
but not in our country yet. So, and certain food pa lang. In other countries, they have, I believe they do have peanut desensitization. And I think some also have egg desensitization already. Pero it's really done in a very tedious way.
Yes.
Okay, so and unfortunately, we don't have it yet, but there are talks of hopefully having one or doing here also in our country. Kaya lang kasi it's sobrang, the desensitization in food is different from the desensitization that we're doing now for dust mites and yung mga inhalant allergens. It's different eh. Yeah, but hopefully we'll have it soon.
And then a couple more horror stories. I mean, because it's tragic, no?
Right.
One is lang I didn't know which one to tell first. I just really like to warn people out there, no. When you hear about it kasi, or you know that it's happened to someone,
Correct.
you really shouldn't take your allergies lightly.
Right.
Especially if you've already been informed. Like there was a lady who was told she was allergic to fish, but she just really wanted to eat it. And this can happen a lot, even to people who are very meticulous and, like they walk around with, okay, just a second, folks, there I am. Woo! Okay, that was, see what happens when you're live? Okay, so she went to a wedding. She ate fish because what she would do was she'd eat the fish and inject herself with the EpiPen and then wait for the ambulance. Kasi matigas ang ulo din. That time when she opened her bag, wala yung EpiPen. Because changing bags or whatever, so she died. Okay, long story short, she died. So parang don't take it for granted, or even if you always have the medication with you, there might be a time when
the EpiPen should be there not to let you take it, but as a emergency medication.
Yes.
Sa mga accidental ingestion or exposure.
Yes, and also the another one I heard of a few years ago, the cousin of a friend of mine. She was very young and she was allergic to shrimp, but she kind of got used to taking the antihistamines because she really wanted. And she was out of town, out of Metro Manila actually, and then she ate shrimp and they couldn't find a drugstore or a hospital, and she also died.
Sobrang sad, no? Kasi this could have been prevented, right?
Yes. And it's not like it was really her fault, but you should really be careful and don't peer pressure people. That's so irritating when you have speaking of someone who has allergies, no, you can eat it. Sige na, try it. Come on, ganyan. Right. They don't understand the severity or what it feels like. No,
right.
No, ganyan. Don't be scared. Ganon. So, if I hear that around me, I'll be like, wait a minute, call Dr. Aquino.
Oh yeah, dapat talaga. You're correct, no? Instead of encouraging your friend or your companion to eat it, dapat talaga if they're allergic, then avoid it. Yeah.
Ganun pang I've heard one time. Sige, dalhin kita sa ospital ngayon. Ay, naku, nahirapan na yung tao. Hindi na nga.
Right.
So, you'll bring it to that point where they cannot breathe, they're having all this just para samahan ka lang kumain. Please refrain from doing that, folks. That's my plea to you. Also, you'd rather spend the night at a hospital because you want your friend to eat with you. And what if you cannot save your friend's life?
Yeah, tsaka you don't know how the reaction will be, diba? With that encounter, right?
Doctor, we're talking about allergy tests and how to test for them. What allergy tests are available? Skin tests? Can you just sort of describe them for us?
Right, okay. So, allergies here, we are all trained to do the allergy skin test. So it's just a prick test, no? So basically, usually here at the forearm or at the back. So what we do is we drop or scratch your skin with the allergen, with the lancet. So it's a little sharp, pero hindi siya yung sugat level naman, or it's not an injection. So it's just a scratch. It's just a scratch test. And then we observe after mga 20 minutes to read on it. Usually, it's a 3x3 millimeter wheel for it to be positive, or you also measure the erythema or the flare around it. No, so actually there are parameters when we say if it's positive or negative. So that is the most common and cheapest, and actually, should I say more convenient? Kasi mabilis lang eh. Parang you go to the clinic, as long as no antihistamine for the past 7 days, you can have the skin test done, and then you get the results after 20 minutes, and then we discuss already. But now, available also here now in our country is the allergy blood test. No? So we have it here in Makati Med, where they extract your blood and then they run it through a machine and then they see, no, so specific then where you are allergic to. The difference lang syempre is the cost.
Yes.
Kasi sobrang mahal talaga the reagents for this allergy test. So malaki yung price difference talaga. Okay? Siguro parang 2 allergens lang ang na-test mo sa via blood na parang nakatapos ka na ng isang panel ng inhalant. Okay, so that's the difference. Kaya lang kasi the blood test works for patients who cannot be off antihistamine. So those who really have bad rhinitis, or let's say patients with really persistent urticaria, and you really need to do the allergy test kasi parang mukhang may allergy component her allergies or his allergies. So yan. And then also in children who cannot be contained, no? Especially let's say may ADHD or autism yung patient. Syempre you can't make them sit still and do the allergy test. Then blood test can be but usually for older children and adults, the skin test is actually very good kasi they get the results real time at the same time in 20 minutes, and then they see the reaction. Iba kasi yung nakikita nila when it really forms a wheal and a flare, as what they call it, yung talaga nag-hive or nagpantal, and then i-discuss mo sa kanila. So parang tingin ko it's easier to educate someone who really sees the reaction.
Yes. It's more, it's visual, it's there, they can and then they're not gonna say, I don't believe you, or right away, because there's often they can
they see it.
It's not painful, just letting people out there, it's painful, but it can get itchy and your doctor can get something like this for the the itching right now. I know before you used to do skin tests where you inject medication under the skin before.
That's for the actually that one is still being done, pero the recommendation kasi niyan before is that when you do a skin test and it's negative, okay, the next step is, that's what they call intradermal.
Yes.
You have to dilute the allergen and inject under the skin.
Is that
right? Pero kami, we don't always do it na kasi sometimes if let's say negative the skin, well actually it depends, pero that's the recommendation. Kung negative the skin test, you do the intradermal or under for that allergen. Yung common na nakikita natin ganyan is still sa medications that's given via IV.
Yes.
Okay? Kasi that's how we really can do it. Pero yung recommendation na yan is very dilute. And then, syempre, that's the only way you'll give it talaga is under the skin or intradermal, and then you measure it. So, meron pa rin, pero on IV medications.
Thank you, doctor. I wanted to ask about that and kind of have you explain it a little, because people are also allergic to medications. We're forgetting that, no?
Right.
People are allergic to maybe even
antibiotics, pain relievers, very common, NSAIDs, no?
NSAIDs, yes. And then if it's given before, a long time ago, like before trying a new medication on someone, even if it wasn't an allergologist who was in charge, they would
do skin test, right?
Yes, under the skin. But how come it's less practice now? But it's
okay. Kasi the basis for doing that skin test before was there was one case na yun nga, no, again in the Western country, nagdevelop ng allergy, so nakasuhan yung doktor. So parang the naging practice na lang was always do a skin test before giving the medications. But now, where we are doing a lot of studies, it showed that doing that skin test doesn't guarantee that you do not have allergy to it. And in fact, doing that intradermal skin test can actually cause an allergy to it. Nakuha mo? Pwedeng that skin test will be the trigger for you to develop the allergy. Parang yun yung tinatawag naming sensitization phase.
Okay.
So, hindi siya guaranteed.
Vaccination. Thank you.
Yeah, kaya we don't do it now. Because I remember maraming ganyan na, and yun lang unfortunately, a lot of, especially the older doctors, bakit hindi skin test, nag-allergy tuloy? So now we're here to educate na just because hindi nag-skin test doesn't mean na mali yung ginawa ng doctor. Kasi doing the skin test, and how many patients have we seen that the skin test was done, it's negative, and when they give the medications, that's when it comes out, or 5 days after, that's when the allergy develops, right? And doing the skin test actually makes giving the antibiotic delayed. Siyempre, na nga to treat the patient, diba? So, that's the reason why the skin test, the recommendation talaga for the skin test is just do it if the patient has a history or questionable history of drug allergy to it, and the patient really needs to take it.
Okay.
So that's why we do the skin test to check kung positive siya, then kung that's the only drug of choice or that's the only one that the doctor says that the patient can take, then we do the sensitization after.
Okay.
And so we only do the skin test if, again, well, actually, just like the skin test that we do for the allergens and food, you only do the skin test if by history, meron siyang allergic reaction or questionable allergy doon sa certain substance, be it the inhalant, the food, or the medication. Pero kung wala, you don't need to do an allergy test. In the same way that there are some people who come to the clinic na, Doc, gusto ko magpa-allergy test. Or meron din ako dati na-encounter, Doc, magsi 6 months na yung baby ko. Kakain na siya. May history ako ng food allergy. Baka siya meron din. So, can we do a skin test? We don't do that, no? You don't do an allergy test and then be guided on what to give your child. It's the other way around. You have to give it first. There has to be an exposure first. And once there is a parang history of reaction, then that's the only time that we will recommend or do an allergy test.
Okay, doctor. That is a much better explanation and certainly more acceptable than, you're in the hospital, you have allergies na nga, and then I've encountered this between making other people bantay and being in the hospital myself. I am also, one of the reasons that I wanted to do this show or a show like this in the first place was because I'm the person who brings people to the hospital and all that. And then I've also been there for many, many reasons. Like I've stopped counting already how many times where I used to be hospitalized. So I'm just saying from my experience, no, if it used to be done to you, the skin test to make sure, and then you've had reactions, or you're afraid of that. And then sabihin lang nung nurse or whoever, or even na doctor na, hindi, okay lang yan, sige, if you can't breathe, we'll give you something. Parang it's explained the way Dr. Aquino explains. Diba? Yung, oh, so you want to experiment on me now? And there are some people have already told you already, I'm allergic to that, and then you don't want to believe me. I've already had that experience. Like let's say you said with NSAIDs.
Right.
No, just try it. No. I've seen someone argue that when I was like, with a doctor somewhere else, I was like, Doc, just, you're gonna make her nervous. Please listen to her. And the doctor's like, sino ka ba? I'm like, awan ko, sino ka ba? It wasn't in Makati, but it was like, come on, listen also to the patient. Explain. The way you've explained it was really good, because it might make you more sensitive because this, because that, and we're gonna make sure we're on standby with something to relieve you because you really do need to take this. That's why sometimes also patients become argumentative because it's not explained to them
They don't
properly.
understand.
Yes, and scared, Okay, so thank you, doctor. See, at least now someone has explained it on this platform, and I hope whoever needs to watch this and listen to it gets to watch it and listen to it also.
Right. Okay.
And then so when it comes to that, medications, so when somebody has to take a medication how about vaccines?
Okay. Allergy to vaccines, there are some reported cases, pero konti naman. Ideally lang, if it's really a bad reaction, you don't take it na. Actually, pinakamahirap is usually the anti-rabies. That's why I refer na lang to check if it's really an allergic reaction. But there are some who really reacts bad to it. Do we desensitize for vaccine? I haven't done it. Usually, if it's really a bad reaction, we just don't give it or change to a different type, the one that the patient can take it. Pero so far, ako personally, I haven't, yun talagang bad, yung allergic talaga na na-prove, parang hindi pa. Very rare naman siya. I guess, siguro parang what you wanted to ask is there a treatment? Let's say this patient is allergic to certain medications. Like for example, NSAID. So it's a wonderful, wonderful pain reliever for whatever it is. Pero there are a lot of patients who get allergies to it, diba? Mefenamic, ibuprofen. So with that, if you're allergic to it, we really cannot do anything. The problem is yung drug desensitization. You have, once you're desensitized, or once we do the desensitization procedure, you have to always take that every day.
Okay.
So let's say we desensitize usually on antibiotics, diba? Or anti-TB drugs. So yun, pwede mo i-desensitize kasi the patient will take it every day for months or antibiotic every day for 7 days. Pero once you stop the medication, you have to do the desensitization again.
Okay, yes.
Okay? So that's why yung mga pain relievers like NSAIDs, we do not desensitize them kasi you just take them as needed.
Yes. And perhaps some people who work in the medical profession, like in another hospital anyway,
Right.
will listen also to the patient and their family when injecting things like allergic nga siya dyan. So just give the person a narcotic if they're in so much. You're observing them anyway. They're not gonna walk out of there with your injectable narcotics and go, "Woo, I'm high right now."
Ano naman, yeah. For pain relievers, there are other options that they can give. Yun nga lang, it's not siguro, magaling lang din talaga NSAID sana, pero there are other, like me, I'm allergic to NSAID, so I just have to take other type of pain relievers.
So you'd probably take a milder one, but if you were really in a lot of pain and it was necessary, then they would give you either a
Higher
narcotic
ones.
or
For me, so far I can take the higher one. So meron naman, especially now this day and age where research, you know, there are so many medications coming out.
a narcotic
So
or an
there's always an option for
anesthetic.
everyone.
Yeah, exactly. Thank you, doctor. I'm not trying to advocate for narcotics. I'm just saying sometimes people get so strict and caught up in it, but it's needed and they're in the hospital.
Right.
Okay. All right, doctor. So when it comes to the blood test, that's very interesting. It's here already now. It's just the cost, no? And the
Right.
test. And are there, okay, you can desensitize towards inhalants,
Right.
like pretty much successfully now. How about also skin allergies?
Okay, the studies for desensitization and atopic dermatitis is not very very good. Basically, for desensitization to the inhalant, it works more for allergic conjunctivitis sa eyes, allergic rhinitis, and asthma. The problem with atopic dermatitis, it's not all, parang the cause is that it's not all allergy. With atopic dermatitis, the main problem is the skin cannot hold moisture. Parang it's always dry. So the histamine part, it's very, very small lang, no? Yung cause ng itchiness. Parang ang atopic dermatitis play parang marami siyang mediators or marami siyang pro-inflammatory markers. That's why actually for atopic dermatitis, the treatment now that they're working into are what we call the biologics. Parang they target the specific cause for the itch. Siguro that's how I'll put it in layman's term. Kasi nga, di ba, steroids is a wonder drug for atopic derm, di ba? When they apply steroids or when they take in steroids, talagang nawawala yung rashes or the symptoms of the patient. But you know, you can't take steroids for a long time. So now they're looking into yung mga biologics, no? Anti-IL-13, yung mga blockers na talaga nung nagkukos ng itch. So ganong level ang atopic dermatitis.
And also, I guess, doctor, no, I mean, you get exposed to the water might have too much chlorine, and then the
irritants.
foods,
Atopic dermatitis just has too many factors to consider.
How about for food?
For food, desensitization, yun nga, specific lang talaga. Pero we don't have it here yet, no? Although in our conventions, parang they're guiding us on how to go about it, pero yun talagang how we do it, it's not yet done here in our country, but there are others who live in other countries that they've already successfully desensitized. They do it in other countries. Like in
Have they done it to peanut? Because a lot.
Yes, so you have to take peanuts every day after the desensitization. Yes, and it's successfully done.
But don't take that out of context, guys. Don't do it here. That's a doctor doing.
No, kailangan mag-desensitize ka muna and you graduate first from your desensitization. Then, meron ka daily intake of your peanuts.
Because I remember there were cases before, even in the 90s, of, you know, kids or other people who are allergic to peanuts and they're on a plane. And even 6 rows forward, because I guess the air is circulating in the same environment. Somebody opens a bag of peanuts or 2 rows forward, back, allergy.
Correct, yeah.
Is there a doctor in the airplane and the doctor's like, oh my God.
So I think they stopped giving peanuts na.
Yes, they actually did a lot in a lot of airlines. So, so I'm glad that the airline industry listened to that because, you know, there were a lot of cases.
Correct.
So, okay, doctor, okay, so medication, do you desensitize to that? No.
Yes, desensitization to medicines we do, especially if needed. But usually these are, as I mentioned, more for antibiotics.
Yes.
Talaga, yeah.
Yeah, I was just, wondering all of that. It was also so difficult during the period during the COVID pandemic where it was scary for a lot of people
Right.
who had allergies. And often when you have an allergy or someone it has an allergy, there's also anxiety that plays in.
Correct. Yes.
And the thing is, the symptoms of anxiety can mimic also the symptoms of allergy, and vice versa. So, hello? Hi, folks. Just a minute. Just a minute, folksy woksies. Let me just fix this technical thingy. All right. Hi, doctor. Okay, let me just try to get doctor back online. Hello? All right, folks, we're just going to take a short break and we'll be right back. Let me just get doctor back online. Oh, okay. Sorry, doctor.
Okay, we're back. Sorry. Okay.
Where are you? Where are you, doctor? Okay. No.
There. I'm good. Okay.
Okay, let's see. Okay, so it was difficult because for a number of people with allergies, because whether or not they had to take the antibiotics or they were sick at that time,
Right.
and or the vaccination. I mean, as I was saying, anxiety plays a role, and anxiety can mimic some of
Mimic. That's correct. Right.
and vice versa. Then if you have an allergy, baka you think it's anxiety lang, pero your blood
Right.
pressure drop na.
Correct.
So, yeah. And
To answer your question about the medications, and before we go in, very important. Again, if you're allergic to that class of antibiotic or that certain brand of antibiotic, do not take it anymore. Anyway, there are so many antibiotic now out in the market. There is always an antibiotic that the doctor can give to you.
And it's possible also, doctor, that, let's say, cephalosporin, which is like,
Right.
tanda naman ng ano mo, pero, no,
But it's very common and we still give it even until now, right? Correct.
let's say you're okay with erythromycin and azithromycin, and they're kind of, you see the isins, they're sort of related, right? And then somebody says, this is best for you, take a cephalosporin, and then maybe you took it once, but then after that, you take it again, you're allergic to it, and it causes
Right.
symptoms. So be careful with that and make sure you let your doctor know.
Yes, you just really have to tell your doctor it. Yeah, because usually when we see patients, actually there are some doctors when on history taking, parang sabihin ng patient na parang nag-rashes po ako dyan dati, hindi ako sure. They refer already. Kasi nga, para yung treatment is guided as well, what they can give. Okay.
So doctor, we're gonna have to go in a couple of minutes.
Okay. Yeah.
Just want to share a story. One time I was in a hospital room and the interns or residents were having this discussion because they were teaching. It was a teaching moment for the doctor. The patient was allergic to all sorts of dyes, and they were like, yeah, but we need to get an MRI of something. And then finally, they kept going back. The doctor asked me, what do you think? I said, I think you should just give some diphenhydramine an injection when you put the dye para ma-relax na lahat. Okay. I mean, sometimes kasi
it worked.
It worked. It was a teaching moment para ma-relax na lahat. And, the patient was getting okay.
Anxious already kasi the patient can hear it and they were discussing.
And for that moment, diphenhydramine is probably, it has a shorter.
No, but actually, for the contrast media, so call it yung mga dye, that's one of the recommendations is actually you can give your steroids and antihistamines hours before the procedure.
Oh, sige. Tama pala.
Tama.
Kaka-hangout
Tama na naging patient mo sinamahan. You know what to do. Pero the lesson there is do not discuss in front of the patient.
Or minsan marunong din kasi alam din ng patient tapos parang ayaw pa ninyo makinig. Yeah. So kudos to the doctor. It was a teaching moment for the doctor. But the doctor's like, kasi may, okay, sige. Pero, and kudos to you, doctor. So, sa kakasama sa inyo, pwede nang
already.
Okay. Doctor, is there anything you'd like to say before we say bye to our audience?
Yeah, I guess the takeaway lang really is do not take your allergies lightly. If you think you're having an allergic reaction or you think you do have certain allergies, then please see a doctor and discuss it so you are well educated. Actually, as allergists, that's what we really want, no, for the patient education. Okay, kasi it's very important for them to know what their allergies are, if ever there is, and if it really was an allergy. And of course, very important is how you treat your allergies. Remember, if you have an allergy, it's something that your body doesn't like. It will really cause a bad reaction. So as much as possible, you avoid it. As much as possible, do not, parang no encounters with it. And then you always have your medications with you, and you have to identify the first signs of your allergic reaction so that you don't get into anaphylaxis. Okay, so there. So I guess that's basically what we want to share. No, it's more an education and to really know more and understand your own condition. Because remember, just because a friend or a family has it doesn't mean that your allergies is going to be the same or the same reaction. It can be different. So personally, you have to know what you have and what you are allergic to. Right.
Thank you very much, doctor. I'd like to say hello to Tata. Tata, I love you. Mommy, I love you. And how about you? When you want to say I love you to or I hate you? Just kidding.
Yeah, I love you to my kid.
All right, so we have to go for now, folks. So we'll be back next week again with Healthline with Makati Med. I'll be back with you next week with another doctor, but it was a pleasure having you, Dr. Aquino.
Thank you again for having me, Nicole.
You have to come back and come back and come back. Okay.
Anytime.
Bye for now.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.